Reports suggest that up to 90% of suicides are preventable, provided that help is available. This webinar presents guidelines to help recognize when someone is in trouble and offers suggestions on various ways to offer initial support. The goal of the webinar is to provide some basic information. These guidelines provide direction in estimating if a person is likely to commit suicide and instructions on offering temporary support during an urgent situation. The webinar is not a substitute for proper crisis intervention training, counseling, or psychotherapy. My name is Nicole Schwartz, and I work as a contractor in the Family Services section of the Family and Morale, Wellness, and Recreation DLA Installation Support at Defense Distribution Center, Susquehanna, in New Cumberland, Pennsylvania. Providing support and assistance to the Family Advocacy Program, or FAP, is the focus of my work with DLA. Family Advocacy is a Department of Defense sanctioned program designed to prevent, identify, report, and treat families that have experienced domestic violence or child abuse. Monthly workshops and webinars are part of our regular programming. Understanding suicide. One of the first things to understand about suicide is that it can strike almost anyone. Most adults experience some vague suicidal thinking for 1 or 2 brief periods of time during the course of their lives. Fortunately, most do not act on those thoughts, but shift their energies to survival activities and to productive life functioning. Suicide is a conscious and deliberate act of killing oneself. There are many reasons why a person might take such drastic action. It's rare to find a single cause. In most cases, many factors may be combined together. The slide indicates some of the stressors related and correlated with the occurrence of suicide. It's natural for human beings to do everything possible to avoid dying. Why then would someone choose suicide over life? Suicide comes about when people are in an intensely painful emotional state. They can't think clearly, and they lose hope and see no resolution to their difficulties. Suicide may appear to them to be the only way out of their overwhelming pain or frustration. Some of the potential reasons for suicide include isolation and loneliness, intense loss or grief, severe family, work, financial, legal, or social problems, substance use or abuse, mental health conditions such as depression or other illnesses, severe chronic stress, intense embarrassment or humiliation before family, friends, or colleague, and also overwhelming guilty feelings when one's actions may have caused serious injury or death. Some of the motivations behind suicide are included in this slide. Individuals may choose to commit suicide in order to avoid or end perceived pain, in response to an internal impulse, to avoid humiliation or to gain attention, to be perceived as a martyr for a particular cause, or to avenge a perceived wrong, to express grief or resentment over a change in a relationship, to escape an intolerable situation or problem, or in a number of instances to manipulate others. There are a range of suicidal behaviors that include suicidal thinking, vague and organized thinking about suicide, but no actions are taken during this set of behaviors. Suicidal gestures include non-lethal behaviors which shows one's frustration or other intense emotions. It's like making motions like someone is cutting his or her wrist. Another example would be taking a small amount of prescription drugs to gain attention. The person has no intention of dying by making a suicidal gesture, but the gesture is a cry for help or an attempt to gain attention. Another one of the ranges of suicidal behaviors includes attempts. This person takes actions that are dangerous or potentially lethal with the intention of dying. And finally, on the continuum is an actual successful suicide or completion. And this is when self-inflicted death occurs. Attempted suicides are very serious. Nationally, approximately 734,000 suicide attempts take place every year. Every attempt is a serious threat to human life. Take them very seriously. Some people make serious attempts before actually dying. Females attempt suicide 3 times more often than males, but males die by suicide 4 times more often than females. In most cases, professional psychological counseling is required. And before we move on to talk about some of the risk factors and signs and symptoms, I want to talk a bit about the myths related to suicide. These myths are false. People who talk about suicide are unlikely to do it. False. The possibilities increase with conversation regarding suicide. Suicides are impulsive. False. A majority of suicides are not impulsive acts, and most have been preceded by many clues or warnings. Suicidal people really want to die, and nothing will stop them. False. Most suicidal people are undecided whether they really want to die or not, and most just want to stop the pain. The next myth. Once a person is suicidal, then that person is always suicidal. False. Suicidal crisis is usually short-term. With help, a suicidal person may never become suicidal again. When people seem happy after a period of depression, they are no longer in danger. False. Numerous suicides have occurred when people appear to be getting better. This is especially so if they have not been receiving professional care. The next myth. Wealthy people are more likely to die by suicide than the poor. False. Suicide is represented roughly equally among all levels of society. Suicidal people are always mentally ill. False. Suicidal people may be sad, but they are not necessarily mentally ill. And the last myth I wanted to touch on. If there is no note, then it could not have been a suicide. And this is also false. Many suicides occur without a note. So now we move on to prevention. The United States and many other countries recognize suicide as a public health problem. Prevention programs have been developed by many federal and private organizations. Awareness factors most likely to contribute to suicide. Education to emergency personnel, school systems, and other groups. Early detection programs. Assistance to families in which potentially suicidal person lives. Improved intervention programs once a threat is recognized. Access to mental health and substance abuse treatment programs is another prevention method. And the increase in research meant to develop better understanding of the problem of suicide. These all make up a package of prevention services that are available. In order to prevent suicide, we must know the warning signs. We must talk openly with the person, show care and concern, take the person seriously. Do not underestimate the power of understanding and support. Seek professional assistance, and call an ambulance or law enforcement personnel in an emergency to transport this individual to the hospital. So let's talk about what an elevated suicide risk threat is. This is a continuum of severity. An individual who is experiencing depression is at low to moderate risk for committing suicide. Depression plus a recent triggering event increases the likelihood that they would become suicidal and makes this a serious threat. Depression plus a recent triggering event and the presence of a weapon increases the likelihood even further and makes this a dangerous situation. And an individual suffering from depression with a recent triggering event, the presence of a weapon, and alcohol or substance use makes this an extreme threat, a very elevated danger. It increases the likelihood that someone will follow through with their active plan to commit suicide. There are signs and symptoms of depression and signs and symptoms of suicide. The clues to suicide may be obvious, hidden, or even mixed. Obvious clues are those that are clear to others. They include direct statements about suicidal intent, like "I'm going to kill myself," or "I'd be better off dead," "I wish I were dead." Making preparations for death in the very near future, for example, buying new clothes to be buried in or telling other people about their plans. Access to or having weapons around and drinking excessively. These are another obvious sign. And greater levels of obvious risk-taking behaviors that are seen by others and may cause them concern. Hidden clues are not so obvious to other people. They could include extended loneliness caused by living alone, purposeful withdrawal from friends or family, excessive spending when one does not have the financial ability to cover the expenses, taking leaves of absence for extended trips which are not affordable, giving away important personal possessions, expressing feelings of rejection, feeling like no one cares about the individual, changes in personality, thinking about death frequently, making a will, buying a weapon, and potentially making a practice run. Mixed clues are the final type of signs and symptoms, and mixed clues are those that can be seen as either obvious or hidden clues. An individual has a loss of clear thinking. They have rigid thinking in which a person's unable to problem solve or find alternative solutions to a problem. Frustrations with everyday living, elevated anxiety feelings, feeling out of place, upset, or confused. All the signs and symptoms presented in the preceding page can be hard to remember in the midst of a potentially suicidal crisis. In 1983, a mental health professional, W. Patterson, and his colleagues developed a memory jogger that might help in an emergency. It's called the SAD Persons Assessment Tool. It was published in the Journal of Psychosomatics. And here's a summary. If you see, the mnemonic SAD persons indicates a risk factor. Sex, age, depression, previous exposure to suicide, ethanol, which is the medical term for alcohol or even drug abuse, rational thinking loss, social support system lacking, an organized plan, N, no spouse or significant other, and S for sickness. People who fit the SAD person's profile are at a greater risk of suicide than those not fitting the profile. The more items that are present in a particular person, the higher the suicide threat. These are 10 steps to safety. Secure the environment. Isolate an individual that has a high level of risk from additional tension in anyone or anything that seems to be provoking. Contain the person within a particular area. Don't let them wander about. Don't leave them alone. Reduce the number of stimuli. So if you're interacting with an individual that is at a high risk of following through with their active plan to commit suicide, securing the environment, them and their environment, is one of the first steps to creating safety. Develop or reaffirm trust. Introduce yourself if the person doesn't already know you. Let them know that you're trying to help them. Only one person should do a majority of the talking with them. Let them know that you take their threat very seriously. Try to get on the same eye level as the person. Listen carefully and answer questions if you can. Respond with appropriate comments such as, "I can see how this situation is distressing to you," or "You seem overwhelmed by all of this. I'd like to assist you in dealing with it. How is it that I can help you?" If your sincerity is challenged, simply reaffirm that you're there to help and that you'll do your best. The next step is a risk assessment. Ask what's recently happened that caused the person. This is known as a trigger. Ask direct questions about the feelings of suicide. Have you been thinking about killing yourself? How suicidal are you? You can also explore the risk factors in the SAD person's assessment. These questions are important in the risk assessment step. Figuring out how suicidal the person is on a scale of 1 to 10. How did they plan to kill themselves? Do they have means? Do they know anyone that has successfully killed themselves? Were they related to the person? Have they ever made a previous attempt? How serious was the attempt? What kept you alive up until now? And what may happen in the future? The next step may be to develop a greater understanding of the person in the situation. Ask questions about what led up to the current crisis and listen carefully. Focus on the life side of the person's ambivalence. Offer support and understanding and encouragement. And focus on the main problem. If more than one main issue, take each one individually, trying to hear the person's pain. Try not to rush the discussion. And discuss alternatives. The suicidal person may be very rigid in thinking and not able to see any alternatives. To help break out of the tunnel vision, work with the individual to develop a list of possible solutions. Be flexible and optimistic. It's important that you not lie and don't promise anything that you cannot guarantee will happen. The 7th step would be to pick the best option. From the list of possible alternatives to suicide or solutions, pick what appears to be the best option with the greatest chance of success, and develop an action plan. The suicidal person must be willing to participate in the plan, making the steps of plan as specific as possible, and then implement the action plan. Help the person to begin to help him or herself. You may have to do some things like make phone calls or arrange resources, provide transportation for the person since the person is in a suicidal crisis. Step 10. Referral for further evaluation and possible treatment. Immediate referral to a hospital or some other protective environment. You could also find resources for people such as physicians, school counselors, mental health professionals, chaplains, psychiatric hospitals, veterans centers, or law enforcement or police. The resources for people who are in imminent danger or those who have made attempts. Call 911, emergency departments, crisis hotlines, or military OneSource available at 1-800-342-9647. I wanted to leave you with a list of resources for local crisis units and also agency resources. Cumberland and Perry County Crisis Intervention, Dauphin County Crisis Intervention, and York County Crisis Intervention all offer immediate services to individuals who are in a suicidal crisis. And also, the Family Advocacy Program and DLA Employee Assistance Program are available for any employee of the organization. The goal of this webinar was to provide some basic information. These guidelines provide direction in estimating if a person is likely to commit suicide and instructions on offering some temporary support during an urgent situation. The webinar is not a substitute for proper crisis intervention training, counseling, or psychotherapy. The suggestions provided are not intended to cure any psychological disorder or distress. Please keep in mind that people in a suicidal crisis, more often than not, need the services of a professional mental health personnel. When in doubt, always refer a person to a professional for further evaluation. With knowledge and help, it's our hope that hearts can heal. Thank you for viewing the Family Advocacy Program's webinar. We appreciate your time and attention. If you have any additional questions regarding FAP, seek referrals for programs or services, or would like to know more about our mission, please feel free to reach out to the Family Advocacy Program Manager at 717-770-7066. Thank you.